Hi, everybody. I'm Paul Maloof. I'm one of the orthopedic surgeons with Tidewater Orthopaedics. And we're here tonight to talk to you a little bit about one of my favorite subjects, bunions. I'm a foot and ankle surgeon with Tidewater Orthopaedics. Just to give you a little background, we are a subspecialty orthopedic surgery practice. We've got multiple offices. We have an office, our home base is in Hampton, Virginia. We've also got an office in Williamsburg, and we also have an office in Suffolk. We practice mostly out of the Centera system at the Centera Careplex Hospital, as well as Centera Williamsburg Regional Medical Center. And we're very proud to operate at the Centera Careplex Hospital. We have a facility there called the Careplex Ambulatory Orthopedic Surgery Center, which is the only subspecialized orthopedic surgery center on the peninsula. Very unique hospital. Only orthopedic surgery is done there. Only well patients are done there. No infections are ever done there, so it's a very safe place to have surgery. Everything is done as an outpatient. Within our practice, we've got multiple different subspecialists. We have doctors that just do sports injuries, doctors who just do spine, some just do shoulder, some do knee and hip replacements. I do just foot and ankle. We've got hand surgeons as well that only focus on the hand. So just a little background about who we are and what we do, Tidewater Orthopaedics. So today I want to talk to you a little bit about bunions. And bunions are a very complex problem. A lot of people think that, oh, it's just a bunion, it's no big deal. That's an easy recovery and an easy surgery to have if you have a bunion, but it's actually not. And, for a while, it was a very difficult procedure until a company called Treece came along, and they came up with a new way of doing bunion surgery. So it's kind of like a spin on an old procedure that's been around for a very, very long time. So just to give you a little idea of the anatomy of the foot and what a bunion is and why it's there and why we would fix it, they came up with this beautiful poster presentation that I'm just going to use to kind of go through it, okay? So why don't you zoom in down here real quick, and I'll show you a picture here. This is a typical foot that has a bunion. And you can see here where the big toe is, there's kind of this bump right here on the side of the foot. And as you can imagine, that makes the foot kind of wide and difficult to fit into your typical shoe, especially some of the shoes that people like to wear today that are, very kind of narrow and tight around that part of the foot. So it causes a lot of discomfort. Here's another picture to the side here with the similar type of appearance where there's this big bump here, okay? So people come to me and they say, Dr. Maloof, can you just shave off that bump on the side of my foot? And I it's very difficult to explain it, and this poster really kind of helps. Here's also a model of a foot, and this is what a normal skeleton of a foot would look like, okay? But what happens, just like on this poster, when somebody has a bunion, is that the two bones here, these are called the metatarsal bones. And what happens is, as the person's growing, these bones kind of spread apart like this. And when the foot is in the shoe, as you can see, the big toe kind of starts to swing towards the little toes. So this is a great model because it actually lets me bend these bones. And this is actually what the foot winds up looking like. So when you see this bump on the side of the foot, like you see down in these pictures down here, it's not really a bump. It's more of a deformity that has happened where these two bones have spread apart and the big toe is going like this. So it's almost like an optical illusion that there's a bump there. What it is that these two bones are curved, and what we need to do in order to straighten that out to be able to fit the foot back into a shoe is we actually need to go in with the surgery, and we need to bring these two bones, the first metatarsal bone and the second metatarsal bone, closer together, okay? And the old way that we used to do this was a little bit difficult, where we didn't have a system that would do this for us. So this system that they have come up with actually allows the two bones to be brought back together much easier during the surgery. And then the way it's fixed, if you look here, this is two of the bones that we used during the surgery that we actually fixed them with this plating system. So you see these two titanium plates and 8 screws that get put between the bone here called the medial cuneiform and the first metatarsal. And that is what allows us to bring this bone in. The beauty of this procedure that I really like the most, which has changed the way I do bunions, is the ability to allow people to get up and walk much faster. The way we used to do this procedure, you'd have to stay off your foot for about 6 weeks, which is difficult. You can imagine your everyday life that you go through, getting up and going to do any of your normal activities, not being able to walk for 6 weeks. Now it cuts it down to about 2 weeks. After that, then people have to walk in a boot for about 4 more weeks after that. But still, you can imagine that that's much, much quicker of a recovery than the way we used to do it. So essentially what I want to do, a lot of people have tons and tons of questions when they come see me about bunions. What I really like to do is answer your questions. We have this new forum, because I can't be in a room full of people to answer all the questions. I think we're just going to allow people to ask questions, and we're going to go through them, okay? So what I'm going to do is I'm going to have a seat back here, if that's okay, and then my camera crew and director Will is going to start feeding me some questions of yours, and I'm going to do the best I can to answer them.
All right, cool. So just to let you know, we do have 48 people watching.
Okay.
All right, so first question. If you don't have any pain, what are other criteria for bunion correction?
Well, that's actually a great question. People ask me that all the time. And people come in with a bunion. Someone told them, you have a bunion, you should go get it looked at, or for whatever reason. And what I usually tell them is to be 100% honest. If you don't have any pain, you probably don't want to have surgery, because the real indication to do the procedure is because of pain. If you have pain because you can't fit it in your shoe, if you're a runner, or if the shoes that you like to wear don't fit correctly. A lot of people, if I use this model, when they put their shoe on, you can imagine if they have a bunion that looks like this part of the foot is always getting rubbed on by their shoes. And they say, I've tried every single kind of shoe that I could find, and it just doesn't fit, and I'm sick of doing this, and I want my foot to be more narrow to fit in a traditional pair of shoes. That's the indication to have a bunion surgery.
All right. Are you sent home with pain medication after surgery?
So that's another great question. So the way this works is that this is an outpatient surgery. You will come in and go home on the same day. Our anesthesiologists are excellent in doing what's called regional anesthesia, where they just numb your entire leg for the surgery. Then you go to sleep with some IV sedation. Then you have the surgery, the foot gets fixed, you go home in a splint, we give you pain medication, and you'll go home. Like I said before, you have to stay off it for about 2 weeks, and you'll take pain medication usually for about 48 hours. Most people tell me that after the 48-hour mark, their pain is gone.
All right. How do you know when it is time to do surgery? How severe must the valix be?
Well, again, that is a personal decision. I've never had a patient that came to my office and I said to them, let me take a look at your foot. Oh, your foot is terrible. You need to have surgery. That's not really how this works. I usually tell people, if you're having pain and you can't, find shoes that fit you, and it's really interfering with your normal activities, and you want to go through the surgery, I will certainly go through the surgery with you. And it's a personal decision. It's not something that I can decide for you.
Wonderful. After surgery, how long before you can return to work?
Well, that all depends on what type of work you do. So that's a different question that needs to be tailored for each specific person. If you sit at a desk, people sometimes go back to work within a week. If you say you're maybe a laborer and you need to wear steel-toe boots to work and you need to be able to stand up all day, climb ladders and things like that, it may take you a little longer. It usually takes people, I would say, 2 to 3 months before they get back to all their activities that they like to do and not have any pain.
Wonderful. When this specific type of bunion surgery is performed, will you also be able to correct hammer next to big toe?
Hammer toes, you absolutely can. So that's a very good question as well. So going back to my model here, a lot of times when people develop a bunion, their metatarsals splay apart like this, the big toe comes over like this. And in some people, the big toe actually pushes the second toe out of the way, and it develops what's called a hammer toe, where the second toe gets curled up and stiff. And a lot of times that causes pain on the top of the shoe when the person's wearing a shoe, and we can correct that at the same time. Usually what that does, though, is that will prolong the recovery a little bit longer because there's a pin that gets driven into the second toe, and that pin has to stay straight in order to keep that toe from curling back up again. So that will actually make that non-weight bearing period of time a little bit longer.
All right. Is this new type of surgery similar to a fusion?
So this surgery is actually a fusion. And one of the questions that people ask me is, well, how many times have you done this surgery? And that's a tough question to answer, because it's not a tough question to answer, but the reason I say that is this is a relatively new procedure, but it's really an improved way of doing an old procedure. So this procedure, which is technically called a Lapidus procedure, is a fusion between these two bones right here, the first metatarsal and the medial cuneiform. You actually fuse these bones together. What the Lapiplasty system has done is it has just made a new way of fixing that fusion, which allows us to walk on the foot a little sooner.
Right. So, compared to metal that you've used for a Lapidus procedure in the past, how, technically speaking, is the trace equipment superior, not including faster weight bearing, and what metal is the product made of?
So these plates are made out of titanium, and titanium, I used to use stainless steel. I used to use stainless steel screws, which are a little bit stiffer, but they didn't allow a little bit of flexion to go on, which the titanium metal, which these plates are made out of, actually allow a little bit of flexion to occur at that fusion site, which just causes a different type of healing. And that would go, to answer that question appropriately, that would go into the differences between types of bone healing, where the old type of healing would be compressing the bones together and then leaving them to heal, where in this type of bone healing, we're putting these plates which have a little bit of flex in them and actually allowing a little bit of flexion to happen, which promotes the body to heal.
All right. What alternatives to surgery are there for bunions?
Another good question. What I tell people all the time is there's non-surgical treatments to everything in orthopedic surgery, and there's surgical treatments. The non-surgical treatment for a bunion would be to wear wider shoes, wear maybe softer shoes at this part of the foot that doesn't cram the foot or cause undue pressure. You could have a cortisone injection, which could give you some temporary relief at the site. You could change your activities to things that don't require tighter shoes. Maybe a little bit unrealistic, but those are really the non-surgical treatments for a bunion.
All right. If you've had the older version of the surgery, can this surgery be done to correct the root problem?
So if someone comes in and they've had a different, so let me refer back to my poster here. What this poster is showing, you need to zoom out a little bit.
Yeah.
What this poster is showing is a contrast between the old version that we used to use to fix some bunions and the new version, which is the Lapiplasty here. In some people, and this kind of leaning Tower of Pisa model is I think it's a very nice model that they've come up with, where they used to shave off a little bit of the bone here, then they would cut a portion of the bone here and try to shift it over. And in a lot of people that would work nicely, but in a lot of people it would fail. And what would happen is that the whole bunion would fall back over again, and you'd wind up looking down at your foot, and your toe would still be kind of going over towards your second toes. If I'm hearing the question correctly, I think that the person is asking me, if you had this type of procedure and your bunion, quote unquote, failed, and your big toe was going back towards the second toe, could you have this procedure to fix it? And that answer is yes. It's a little bit more complex, but I have certainly done that many times before with a very nice success rate.
All right. How far does the splint go up your leg, up to the knee?
So it goes below the knee. You can still bend your knee, but the splint is probably one of those things that people don't love, but it's a necessary part of the procedure. But that is the reason we put a splint on you is multifactorial. One is because it keeps the soft tissues very calm so that the incisions can heal, and it also just helps in case anything gets bumped into the foot, and helps keep everything nice and stable while it's healing.
Where do you perform surgeries?
So most of the time I perform surgery at the Centera Careplex Outpatient Orthopedic Surgery Center. It's an adjunct hospital right next to the Centera Careflex on Coliseum.
All right. What is the downtime like for the surgery again?
So the downtime is typically 2 weeks of non-weight bearing, and then 4 weeks of weight bearing in what's called a cam boot. It's like a large plastic boot, kind of like you'd wear for a fracture, but it's removable. So you can take it off when you're bathing and when you're, say, driving a car or doing any, relaxing, you can take it off. But while you're up walking for those 4 weeks, you need to have that boot on.
All right. Would you or have you used grafts to promote fusion? And what are the pros and cons of grafts?
So I think the person asking the question is asking about bone grafts. We don't typically use any type of graft in a primary fusion situation. We usually would reserve things like that if say there was a problem and someone didn't heal, or we had to go back and do a revision, which does happen with any type of surgery. There's always risks that doesn't happen, that it doesn't heal. And that's very rare, but it has happened. It's been reported. And I think in that situation, you'd consider using a graft, but not typically in a native primary foot.
All right. This person would like to see where on the model the titanium plate will be installed again.
So the titanium plates, so these are two different models. This is just a piece of the foot here, which will be this part. So essentially on this foot, the titanium plates go right across here. This between the first metatarsal and the medial cuneiform. This is the same bone here with the plates on it. I don't know if you can see that.
Yeah.
Okay.
All right. After the surgery, will you be able to wear fashionable shoes again?
That is the goal. I think that's a question a lot of people ask me. And I think that's every foot is different. So can I tell you that you're going to fit into tiny, tiny little stiletto heels? That's to be determined by the size of your foot. But yes, your foot will be much more narrow than it is before you start.
All right. Can you do toe joint replacement for an arthritic big toe along with the bunion procedure?
So can you read the question again? Are they talking about the big toe?
It just says, can you do toe joint replacement?
That's a very specific type of a procedure and question. I can't answer that question. That's a difficult question to answer. That would be a case-by-case type basis where I think we'd have to take x-rays of that person. And so the simple answer is maybe.
All right. How do you test to determine if a foot has hypermobility that would require a Lapidus procedure?
So hypermobility is the indication that they used to say was necessary for a Lapidus procedure. I personally don't believe that hypermobility is the problem. I think that the problem is that when the first and second metatarsals start to move apart, it's not because there's hypermobility here, it's because of a deformity that has happened between these bones. So we don't use hypermobility as the indication to do the surgery. We use more the amount of the deformity that you see here to determine if the surgery is necessary.
Right.
If that answers the question.
Oh, yeah. Is this a permanent fix?
This is typically a permanent fix, yes.
Right. Do you lose flexibility with the procedure?
So that is one of the risks. I have had one person that we've done the surgery on, and I think we're up to 75 of this procedure now, that has lost a little bit of mobility at the big toe. And we had to go in and do a very simple procedure just to release the scar tissue in there. That happens in a lot of different procedures, though. It happens in knee replacement. Sometimes we have to go in and get the knee moving. Same thing with the toe, it happens. But what I will tell you is, with this newer procedure, the Lapiplasty, you do not violate the joint on the big toe. So the risk of the big toe becoming stiff in this procedure is much lower than in the old type of procedure that's detailed here, where you have to go in and actually cut real close to the joint. A lot of bleeding would occur, a lot of swelling would happen, and that joint would get stiff a lot of times. So that is one thing that I do like about this procedure, that you get a lot less of that stiffness occurring.
All right. After the surgery and significant recovery, is running and other high impact on the feet possible?
Absolutely.
Is it common to have bunions on both feet?
It is very common. It's common to have them on both feet. It's common to have one foot that has one and one foot that doesn't.
Do you have any physical therapy after surgery?
In some people we do. I typically like to use physical therapy on a case-by-case basis. A lot of times it's if somebody does get some stiffness, or if they're a little sometimes timid about walking and not wanting to push it, and we'll get a physical therapist to kind of help, push them along.
Does insurance cover the surgery?
It does. It does.
And then does a person need a referral?
That's an insurance question that I have a difficult time answering. You'd have to, ask the proper people, and we have people in the office that can answer all those questions. I'm just not the person to tell you. There's too many different insurance products out there.
What hardware is inserted in the foot to do the correction? The titanium.
That's a good question. So I guess I wish they had brought me that. It's almost like a little clamp that gets clamped. So if you can picture again, we'll go back to our model. So you have your deformity here. It's a clamp that gets inserted. You make a little incision on the top of the foot here, an incision over here, and you insert this clamp, and you actually dial in the correction, and you keep turning until the correction is achieved that you want. You're looking at under X-rays, and once you get to the correction that you want, you stop, and that's when you do the fusion.
If this is an interesting question,
Okay.
so I don't really know how to ask it, so I'm just asking. How would someone test if they are possibly allergic to titanium?
So I can't say that there is any allergies known to titanium. Some people have allergies to nickel, and when they have allergies to nickel, we try to stay away from stainless steel. That being said, from what I've heard from engineers is that there could be a trace amount of nickel in the titanium, but typically titanium is very non-reactive.
All right. Is there a pin or screw installed?
There are 8 screws installed and 2 little metal plates, which again you can see here.
And do they get removed or they stay in?
They typically do not get removed. I have had 1 or 2 people that wanted it removed once everything was healed, but for the most part, 98% of people don't want it removed, don't have any problems.
All right. Is this an outpatient procedure?
This is an outpatient procedure. You come in and go home the same day. Again, they use regional anesthesia where they just numb your leg, and then you just have some sedation. There's usually no general anesthesia, no need for a breathing tube. People wake up refreshed, awake, and usually go home from the hospital, I would say within the hour they leave the hospital.
That's pretty good. All right. I think we are out of questions.
Okay. Thanks again for everybody listening. I would have much rather had a room full of people, but we'll have to make do with what we've got right now. Again, Dr. Paul Maloof, Tidewater Orthopaedics. You can find us in Hampton, Williamsburg. We've got an office in Suffolk. You have another question?
Yeah, let me slip a couple more in. Sorry.
Slip one in?
Yeah, we had
That's
a couple
fine.
more pop in. When both feet have bunions,
Great question.
how do you determine which foot to do the surgery on first? Can you do both feet at the same time?
Okay, so that's a good question. I get that question a lot. The patient chooses which one they want to have first. I do not do both at the same time because, as you can imagine, if you're incapacitated on 2 feet, that gets a little bit dangerous. That kind of becomes risky. If you need to get up, at least you have one good leg to walk around on. And if I take away both your legs for 2 weeks, that could be a little dangerous.
All right. Will a patient with RA be able to achieve good results from the surgery?
That's another good question. Typically, patients with rheumatoid arthritis, it depends on how bad their arthritis is, how bad the deformity is. Sometimes if they develop arthritis at this joint, this procedure is not appropriate, and you'd have to do a different procedure, which we could talk about if you had come to see me. That's a case-by-case basis again type of
All right. Can the metal cause different feelings in the foot in cold climates?
Not typically. I have not heard that. All right. Again, Tidewater Orthopaedics. I'm Dr. Paul Maloof. Please come see us. You can visit us on the web at tidewaterortho.com. You can make an appointment on the web. We've got specialists that take care of all different body parts. We're all board certified orthopedic surgeons. We've got doctors that take care of just shoulders, just spine, hands. I take care of everything from the knee down, sports medicine. Please come check us out.